Ginny Creasman was appointed by the Secretary of the VA as the Medical Center Director of VA Ann Arbor Healthcare System in February of 2018. She's been the recipient of a number of awards which are outlined in your program materials, and her degrees are from the University of Kentucky and Morehead State University. So we want to welcome Dr. Creasman to the podium to talk about the new changes in the VA Ann Arbor healthcare system.
Just to tell you a little bit about myself, I actually am a pharmacist by trade. I got my degree in 1992. Yes, I do look as old as I am. But I am actually, I was a pharmacist, and I came into the VA system, and I loved it. I loved it initially because of all the things I could do that they talked about in school, but you couldn't do in the real world. You could actually do it in the VA. You could actually meet with your veterans. You could actually provide services to your veterans. You could follow them when they were in the outpatient setting or the inpatient setting or long-term care. You could go to their funeral if you needed to. And so I've always loved that about the VA system. I love the fact that we were innovative and we started patient safety things like barcode technology and a computerized patient record before anybody else thought to do so. I stay in the VA, though, because I'm totally committed to my mission, and that's really important when you get into my job, because as you can imagine, Congress is my board of directors, so that can be interesting some days. And so every day, though, when I wonder what is my mission and, what am I focusing on, I just go down and help a veteran. I work as the Red Coat Ambassador up in our front lobby, and this fills my soul and allows me to meet the needs, go back to my office and meet the needs of our veterans. So I really want to thank you for your service, but also thank you for being part of the VA healthcare system. It really allows us to meet your needs, what I think more effectively than any other healthcare system out there in the world. Even though we provide healthcare across the nation, we actually tend to break ourselves up into little pods. And this pod here is called VISN 10. And what it means nothing to the veteran. So let me be very clear. For example, I just received a veteran from up north, which is not within our VISN. I just received him in our healthcare system. He or she can go to wherever she wants to get her health care, where it's available. All this means here is just like any other healthcare system, is we agree to work together. We share a budget. When there's additional resources needed in Saginaw, we work among each other. We try to complement each other and provide services closer to home for our veterans. So what you're looking here is at VISN 10. The lady that you see on the left, or my left, your right, is Ms. Stovall. She's actually our acting network director. The next thing I thought I'd do is I'd spend just a little time talking about the different facilities in Michigan and what they bring to the table. So this is my facility. It's the Ann Arbor VA. It's about 40 miles to the other, well, maybe not quite that. From Detroit, it's about 40 miles. It currently serves about 70,000 veterans, and it's actually growing. You would think with generations moving on and moving forward, it's actually a growing facility. It has, it has about 140 beds. It has an acute care, which means we can provide just about every surgery, just about any of the services you think when it comes to specialty care. We also have a 40-bed CLC, which is what we call a community living center. And this might be remedial to some folks, but the reason I bring that up is a lot of us have community living centers, but they're no longer considered long-term care. Most of the time, if you're living in, Brighton, Plymouth, whatever it is, we try to contract with a nursing home closer to your home if you need a nursing home. We feel that the family members want you closer to home so they can be with you. We actually provide our salute to our veterans and provide services when they're towards the end of life. And then the rest of the patients that are in our CLC and a lot of the other healthcare system CLCs are actually rehabilitation. They might be in there, they had a surgery, maybe they lost a leg, maybe they're learning how to re-walk and use a prosthesis or something, and we actually help them through those first few weeks and give them a place to stay and resources so they can get stronger. Besides the clinical care we provide across the nation, we actually have, we provide education, training to it's about 70% of all the medical students that come through the healthcare systems. So our second mission is partnering with things like the University of Michigan, University of Toledo, when I talk about Detroit, maybe Wayne State, to provide educational opportunities and to work in conjunction with them to improve the healthcare systems we live. But we actually work a lot with our learners. I call it clinical care is what we provide today. Our learners is what we do to help tomorrow. But our research program, which we have one of the largest research programs in the nation, actually is what we do to help for the future. So for example, many folks know that the VA has been responsible for several of the vaccines that have come forward. They actually have a Million Veterans program that's helping us predetermine if there are certain disease states or issues that occur in our veteran populations. We have the exoskeleton, which is allowing people that have been paralyzed for many years to actually get up and walk using an exoskeleton. And at my facility, we're actually doing some work on two things. One is what we call, it's called the artificial lung. But we have researchers that are working to try to come up with a way of making a 3D printer artificial lung. Just in the beginning stages, but again, it's a partnership with the University of Michigan, and it's how the VA helps the nation as a whole. The second thing we're working with, I just had some folks in, again, working with the University of Michigan in our research, to look at what we call precision oncology. And what's that mean to you? Well, I'm an old pharmacist, right? So 20 years ago, if you had cancer, we'd give you a medication and we'd hope we'd kill the cancer before it would cause a lot of damage to your body because it wasn't very focused. It just kind of killed anything that was growing very fast. Precision cancer care, oncology care, allows us to be more targeted and allows us to just go after where the cancer is and address that before it does damage to other places in your body. So we're actually going to be working with them to see if we can come out and do some trials at our facility and help create some changes there, again, in support of our veterans and the community. So the third mission is research. Does anybody know what our fourth mission is? It's emergency management. Actually, when those hurricanes hit down the south, the VA facilities have a very strong infrastructure that allows me to send somebody down from my facility to help the folks in the south whenever there's an emergent situation. So the last thing I wanted to let you know is we have 4 clinics. We currently have, well, I just lied. I have 3.9. So I have a clinic in Toledo, it's a fairly large clinic. We have 10 counties that I cover there. We have one in Jackson, one in Flint, and we have one that's proposed and hopefully will be paid for out of Western Wayne County. One of our next facilities is the John D. Dingle here in Detroit. Just to let you know, it has about 53,000 veterans it serves on an annual basis. It too has about 160 beds, and many of those are again community living center opportunities. They have a research program, not quite as big, but opportunity for us to work together. And having these research programs allows us to bring new things to our veterans. So it's always nice to have a strong program between us both so that we can work together and meet the needs of our veterans. They currently have 2 clinics, one in Pontiac and Yale, and I know that they're looking to see where they need to move to get closer to home with veterans. I will tell you what the John D. Dingle also brings, and what I've been trying to work with them on, they have a beautiful whole health program, which means, you know how we have issues with people being addicted to pain medications and trying to live through some of those stressors and those back pains and issues? They have a program that includes things like exercise, yoga, acupuncture, chiropractor care. As I told you before, I had the opportunity before I came here to Ann Arbor to work in Saginaw. It was the first time I ever worked in a rural community healthcare system, and I loved it. I loved it. I love the people there. They're, like as I said, they're the 3rd largest employer. They're really committed to the veterans and trying to provide services. They also have one of the strongest virtual care programs. And the reason is because they are rural. And I remember meeting a veteran and his father in up in Sheboygan. Anybody know where Sheboygan is? From that facility, you can actually see the bridge. And it's very rural and very out there. And he was just coming out from his appointment. He said, I didn't think I'd like it, but I liked it just fine. And the veteran was getting his health care, his mental health services from the Traverse City VA. But this too, it has about 89 beds. I will say that it's probably only has a small acute care setting, maybe 4 or 5 beds there. Has a larger community-based living center, again, where they're allowed to do rehab and meet the needs of the veterans there. They don't have a large surgery program, not a large inpatient surgery program, but they actually have always worked with their community partners to provide services closer to home. But probably what's most striking about Saginaw is that they have about 9 clinics. And the reason is they serve everybody from mid-Michigan to the bridge. And then there's Battle Creek. Battle Creek is actually an interesting facility. It has a community, doesn't really have a big acute care setting, but it has more of a long-term care or rehabilitation program. It also has a mental health residential program, and that allows us to keep our veterans within the system and gives them a place to go to stay when they need long-term mental health care. They also have a nice residential program, which allows us to transition folks that maybe they had some issues, some mental health issues or substance issues, or maybe they don't have a home. It gives them a place to go and get some services and some opportunities to get back on their feet before we transition back home to their communities. They have 4 clinics, the Benton Harbor, Lansing, Muskegon, and Wyoming. Anybody been to the Wyoming facility? Beautiful new facility. It's over there by Grand Rapids. It has more acute care there, more of the, for example, an outpatient surgery program, a urology program, things like that people might need. But it's over in the Grand Rapids, which is reasonable because, quite frankly, that's one of the 3rd or 4th biggest city in the state, and it needs to have those resources. Okay, so the Mission Act came out a couple years ago, and actually it's been in development over the last maybe 18 months. And the Mission Act allows us to many different things, and so that's why I wanted to talk about it today. Because most folks think, oh, it just allows me to go into the community. That's not all it offers to our veterans. It's probably the biggest, most opportunity we've had in a long time to meet the needs of our veterans, utilizing our community partners, but also establishing some new programs. So for example, the first one, if y'all remember what happened with the access crisis back in 2014, it was clear that we weren't meeting the needs of our veterans within our system, and they were having to wait a long time to get on our system. So they implemented a series of programs. The problem with a series of programs is it's like having 5 contractors in your house at once. We are actually contracting with Optimum, which already provides care out there in the community as an insurance company, but we'll work together to meet the needs of our veterans closer to home. But it rolled it all under one. So it's one, what we call community care network that works with the VA to meet the needs of our veterans. The other thing it did is it kind of put all the criteria together, and it changed it a little bit, right? So you had to be able, change the criteria. You had to be able to provide primary care within 14 days and specialty care within 20 days. It also looked at the eligibility and made some adjustments to that. And it said, or if you have to drive more than 30 minutes for a primary care appointment or 60 minutes for a specialty care appointment, it allowed us to use our community partners. But it rolled under one process. It streamlined it a little bit. We think it's going to pay our community partners more effectively so that they can feel like they can work with us. And then the third thing it does is it makes getting the information back to us more timely. And that's rolled out effective June 6th, and many of y'all might have been using those. You must be, I just tell folks this because this is the heartbreak stories I get. Well, I just went out to a community partner. But if you're not enrolled in the VA system, we're not going to see you. And then you're going to end up with a bill. So make sure you're enrolled in the system. Make sure you have a primary care doctor, and you're working through them with the consult process if you want to use a community partner. The second thing it did is it established an urgent care benefit, and actually it established an ER benefit too, but an urgent care. So one of the sad situations I would have on occasion when I was working in Saginaw, which has an urgent care, is I would have people drive 2 hours away to come to my urgent care. And that was very distressing. And they would come to my urgent care to find out they really needed to go to an ER. But they were so afraid that if they went out to another healthcare system that they would get a bill. So they would drive. And that would have some sad outcomes on occasion. Or they would come to my urgent care in Saginaw, and I would send them over to Covenant because they really needed to see an emergent doctor. So the urgent care benefits allows you up to 3 times a year. You know, you get you're working in the yard, get a rash this weekend, and you need to go in and get some ointment or maybe a shot or some prednisone or steroids to help you. It says you don't have to drive. It says you just need to go on the website, just like with an urgent care, find out which one is in your network, and you can go to that urgent care there, and we'll provide the services for you. And from there, just make sure they have your VIC card and they know you're a veteran. It also allows you to get some medications. Told you might be able to get some medications. You can go to a local pharmacy that's in your network, and they'll provide those medications. You might have to pay a copay at that time, but for the most part, you don't have to drive to get those resources. The third thing it provides is an expansion of virtual care. So, and that's, when I say virtual care, think about it from this perspective. What Saginaw is doing now is veterans will call their urgent care and say, I don't know if I need to see a doctor. And they'll get on the phone, or if they have the ability, they'll get on their video on the veteran's phone, and they'll work with them and they'll triage them, and they'll say, you know, you need to go to the emergency room closer to your home, and you need to go now. Or I think it looks like poison ivy. Why don't I send a prescription of X and Y? So it allows us to use your phone, your computer, to get your appointment. The Caregiver Support Program, we currently have it. It's a fairly small program. This allows for an expansion, okay? But currently, say you're a veteran, you have many issues related to your service, and you can no longer take care of yourself at home. The Caregiver Support Program allows us to continue to provide services at your home, but also a resource so that your caregiver can get paid to provide those resources. Because often, many times, folks find themselves in a situation where the veteran might be at home, but they still have to work. And it's hard to meet those needs, right? So based on specific criteria, and it's going to allow us to expand our caregiver support program so that we can help those veterans stay home longer, get the services they need at home, and have some financial kind of stability as they're working through it. And then finally, one of the struggles we have in the VA healthcare system, and I just experienced it, is it takes about 6 months for me to hire a nurse. I cannot have that anymore. I cannot have that in a competitive society. I need to be able to hire the healthcare providers I need. And the other thing the Mission Act is going to allow me is going to relieve me of some of those authorities and expectations so that I can get out there and be more competitive in hiring caregivers so you get exactly what you need. Go on to www.va.gov, and then you look under the care in the community, and if you go through there should be a couple links, and it'll take you to whether you have an urgent care provider in your nearby. So his question is he's a snowbird that goes down to Florida, right? So I have a lot of those folks that go down to Florida from Ann Arbor. So yes, you can use a clinic there. There are 2 things I would offer. I told you it was the biggest number of veterans there. So I think they're trying to meet the needs. So yes, you can. As a veteran, you can go and get your care wherever you need to get it at. So if you're down there, they have a traveling veterans program, you should be able to go there. The second thing, I would also ask, if you use My Healthy Vet, and it's something like you want to talk to your own primary care physician, the virtual, you can do that too. You have family members or you struggle, or you need, say, couples counseling, to use a vet center, because they are allowed to provide services to, in support of the veteran, like their health care provider or their family members. You can use urgent care at any time if it meets your needs. The VA and Arbor healthcare system also includes 10 counties in Toledo. And one of the things we're finding, we're actually working with the University of Toledo to provide some more specialty care down there to meet the needs of our veterans. Right now what has to happen is they get their primary care there, and if they want to see a cardiologist, they have to get on a shuttle and it comes to Ann Arbor. I was hoping when I walked in today that I would be able to tell you the site of the new Western Wayne County CBOC. Right now, we know they have a site picked. They haven't told me, so I can't tell you even if I wanted to. And we have a contract in place and ready to go. All we need is for Congress to transition the funds, which we're hoping they'll do this week, and we'll have an announcement coming out in the next couple of days. I'm hoping, because I'm on Congress's time. But they have to transition the funds from one color of money to another color of money. We pay the bill, and they start working. We're still hoping for, having our first meeting with the contractor in the site in mid-October. So I think this will help us meet some needs of our veterans closer to home, and hopefully it'll be a partnership between ourselves and Detroit in meeting veterans in the middle. The other thing is, who's heard of a Fisher House? Fisher House, they're great. A lot of veterans still choose to stay within our healthcare system, and they want to come to Ann Arbor to get their cancer care or their surgery or so on. A Fisher House is a lot like a Ronald McDonald House. And we're getting one here in Ann Arbor. It's already groundbroken. As you can see, we're already starting to build it. We hopefully will have it done by January and start bringing people in. But it allows us, say you have to come and you have to get some radiation therapy for a few weeks. Instead of being by yourself, you can bring your caregiver with you, your family member, and you can live in this place while you're there, if you meet the criteria. Why is that good? Because if I can make sure you have good, strong family support, you can pay attention to your health care. If you're worrying about what's going on and do they have resources and everything, it's going to be hard for you to get your services. Anybody been in a Fisher House? It is like being in a 4-star hotel. It is not a Motel 6. It is a high-end hotel with a community kitchen, opportunity for living. You have your own apartment. It also will take kids, caregiver or support, and then but opportunity for you to cook your own meals there, so you're not eating out those bad places you shouldn't be eating out when you're here. So it's coming in January. We're looking forward to it. I think Detroit will be doing their groundbreaking on theirs. They'll have one too. And again, just another way of supporting our veterans who are coming for care. And then finally too, which is always a struggle at my facility, is parking. And we've expanded another 300 spaces. And again, coming in January, we hope to have enough spaces to not only support our veterans, but also to bring all our employees on site, which will go a long way in improving their satisfaction and your satisfaction in the care you get there. Yeah, so she's wanting to know when we're going to get a permanent women's clinic, and I think that'll probably be in 2021. So we have it requires a series of dominoes. So right now, if you go on the one side of my building, we're putting in what we call Skip 2, which allows us to move some of the clinics and the pharmacies over. When we do that, we do the renovation of the other spaces and allows us to move them in. So it's a kind of a domino effect, but it's coming. It's number one on my list because 10% of my veterans are female, and I need to help meet their needs, and I need to quit telling them, come here, and then go somewhere else. So I need to advertise the GeroFit program. You're right, it's a marvelous program. It actually is a program that allows our elderly practitioners to have an exercise program, but actually makes them healthier and stronger. And we're one of the few sites that have it. It's currently located off-site, and eventually it's going to be coming on-site. So what we're doing is it's a 3D printer, right? And what we're doing is trying to create an opportunity that if you have lung that's either been damaged, either COPD or cancer or whatever, that this could, many years from now, be an option that we could use to support you. And it's a 3D printer. Can you get your head around that? It's not an animal. It's something we would print. But we have Dr. Paquet is doing a lot of work with the University of Michigan to try to see if we can get this to function, because it would allow folks with COPD, have lung damage, whether it be caused by many things, to possibly have an alternative. As I told you, they're not mostly long-term care facilities anymore, right? So we usually contract those out so you can be closer to your loved ones. But our CLC, if you have surgery, you have orthopedic surgery, you have a hip replacement, you get a new prosthesis, we will provide you to do the surgery, do the acute care in the hospital, and then we might say, hey, would you like to go down to the CLC and spend the next 3 weeks there getting physical therapy and resources? The criteria is not as much as based on, it's not criteria, it's the care that you need. Let's take Agent Orange, for example. It's identified as an issue. It has to go through Congress. If it's identified and there's a direct correlation, such as Agent Orange or hearing loss due to whatever y'all were, engines and stuff like that, there's a validated that there's an issue, that there's a connection. Sometimes not as fast as all of us would like to see, right? Because I've been around since Agent Orange, and it did not go fast. When it's validated, then it goes to Congress, and we say, we want to support this program for services or benefits or service connection for hearing loss, Agent Orange. It has to be approved from there, and then it has to come back to the VA, and certain criteria have to be put in place, which have to be voted on and addressed, and then it gets implemented. So that would have to be the same process here. Somehow there has to be a way of pulling together to find out how many people are having hearing losses that are directly associated with the lack of proper devices. And then it would have to go through that type of process before it gets to me to either provide benefits or health care. If you touched ground in Vietnam, we could provide you Agent Orange services. But if you carried it on the boat over, it wasn't until this past year, it had to go through Congress, where we could actually start providing services.
I appreciate it. Let's give Dr. Creasman a round of applause.
Thank you.